Many people ask me, so I have a problem with my pelvic floor. Does that mean I should be doing Kegels? And the answer that I say to them is not necessarily. Kegels are appropriate for people who have underactivity of the pelvic floor muscles. Straight up, pure weakness, which may be due to pregnancy, postpartum related changes. Muscles can be overstretched and weak, or aging related changes where the muscles can also be weak and it may manifest as incontinence and or prolapse. In this case, where there's just pure weakness of the pelvic floor muscles without any tightening component, then Kegels would be an appropriate intervention. This would be called an uptraining program. However, people who experience overactivity of the pelvic floor muscles would need a downtraining program. Overactivity of the pelvic floor muscles is associated with tightness, pelvic pain, urinary frequency, and or constipation, to name a few symptoms. There may also be an incontinence component, but this is different than the previously described incontinence. This is incontinence due to tightness, therefore weakness of the pelvic floor muscles, not overstretch weakness of the pelvic floor muscles. An analogy I like to give to help explain this concept is, imagine you're walking around all day carrying a purse that weighs 20 pounds, and then you go and you meet up a friend for lunch and they lend you a few bucks and it adds an extra 5 pounds to your purse. Suddenly, the 25 pounds that you're carrying is going to be more difficult for you than if you had not been carrying anything around all day and suddenly just went to lift 25 pounds for the first time. Same with the pelvic floor muscles. If the pelvic floor muscles are constantly in a state of on and of working, then they're not going to be able to do the job that they were designed to perform as well as they would if they had a chance to rest in between. Therefore, we always want to address tightness before the weakness. So we always initiate a downtraining program in this case before an uptraining program. And very often, the overactivity related incontinence may even resolve on its own just by addressing the tightness of the pelvic floor muscles.